Hello, everybody, and welcome to Mental Health Made Simple. I am Robin Trivett, a board certified psychiatric mental health nurse practitioner. Whether you're here because you're struggling with your own mental health, supporting someone you love, studying for the nursing or psychiatric mental health nurse practitioner boards, or you're just simply curious about how the brain works, I am glad you're here. I created this channel because I believe mental health education should be available to everyone, not just healthcare professionals. Patients deserve to understand what's happening in their own minds. Families deserve to understand what their loved ones are experiencing. Students deserve clear explanations that make learning easier. And clinicians deserve practical, evidence based discussions that improve patient care. My goal is simple: to make mental health understandable. Over the coming weeks, we'll explore mental illness, medications, therapy techniques, neuroscience, psychopharmacology, board reviews, clinical reasoning, and the latest evidence in psychiatry. But before we understand mental illness, we first have to understand mental health. What is mental health? When people hear the word mental health, many immediately think about depression or anxiety or bipolar disorder. But mental health is much bigger than that. Mental health includes how we think, how we feel, how we make decisions, how we respond to stress, how to build relationships, how to solve problems, and how we cope with life's challenges. Every single person has mental health, just like every single person has physical health. Some days our mental health is thriving, other days we struggle. This doesn't automatically mean that we have a psychiatric disorder. Stress is normal, grief is normal, fear is normal, sadness is normal. Mental health develops when symptoms become persistent. They begin affecting our daily functioning, our relationships, work, school, or overall quality of life. Mental health develops when symptoms become persistent. They begin affecting daily functioning, our relationships, our work, our school, or the overall quality of our life. Understanding that difference is incredibly important. So let's talk about your brain was designed to protect you. One of my favorite things to teach is how the brain works, because once people understand the brain, they often stop blaming themselves. Your brain has one primary job: to keep you alive, not to make you happy, not to make you successful. The first priority is survival. That means your brain is constantly asking, am I safe? When your brain senses danger, whether it's physical danger, emotional pain, past trauma, or chronic stress, it changes the way that it functions. We'll spend future videos exploring parts of the brain like your prefrontal cortex, which is your decision maker, hippocampus, your memory center, and the brain's reward pathway that influences motivation, pleasure, and addiction. Understanding these symptoms helps explain why mental illnesses are real medical conditions, not personal failures. So why do people develop mental illness? This is one of the questions I'm asked most often. And the answer is, there usually isn't just one reason. Mental illness often develops through a combination of factors: genetics, brain chemistry, childhood experiences, trauma, stress, sleep, hormones, medical conditions, substance use, life events, and sometimes several of these occur together. Mental illness is rarely about weakness. It's about biology interacting with life experiences. That's an important distinction. So, recovery is possible. One of the biggest myths I want to challenge on this channel is the idea that mental illness means life is over. It doesn't. Every day I meet people who recover, people who learn to manage anxiety, people whose depression improves, people living meaningful lives with bipolar disorder, people who overcome trauma. Recovery doesn't always mean symptoms disappear completely. Recovery means learning how to build a fulfilling life despite challenges. And sometimes treatment includes therapy, sometimes medication, sometimes lifestyle changes, and often it's a combination of several approaches. Mental health treatment isn't about changing who you are, it's about helping you become the healthiest version of yourself. So, what are you going to learn here? On this channel, we're going to explore mental health disorders, psychiatric medications, therapy skills like CBT, DBT, clinical reasoning, brain science. We're going to talk about psychiatric mental health nurse practitioner board reviews for you psych MPs out there getting ready to come into practice, case discussions, new psychiatric research, and practical tools that you can use in everyday life. Whether you're a patient, a family member, a nursing student, a therapist, a physician, a nurse practitioner, simply someone who wants to understand mental health better, you're welcome here. Thank you for spending this time with me today. If there's one message I hope that you can take away from this video, it's this: mental illness is not a character flaw. Understanding creates hope, education reduces stigma, and hope changes lives. If you found this video helpful, I'd love for you to subscribe and become part of our growing community. Leave a comment below and let me know what mental health topic you'd like to learn about next. Until next time, take care of your mind because your mental health matters. And remember, mental health made simple begins with understanding. I'm Robin Trivet, and until next time, be kind to your mind. I'm Robin Trivet, and until next time, be kind to your mind.